Hello again, this is Dr. Tony at Chiropractic Clinic in Upland. I also run the Crooked Spine Show podcast. I'm here with Marcella, Reyes. We're here to talk about how to use self-care and what that means. This is December 2022. We're getting back to routine. We're all going through the craziness of Christmas and the holidays. And what happens in January? We go through New Year's resolution. We want to lose weight. We want to feel better. We want to blah, blah, blah. Every year people do this, but never follow through. Today, Marcella Reyes has a new clinic in Claremont, which is down the street from me, called SoCal Fitness and Massage. She wants to help you understand how she can help you start your self-care. Myself, I get a massage once a month. I work out 4 or 5 times a week. I stretch every day. And I still look for outside therapists to help me stay healthy. So Marcella, take it over. Tell me exactly how you help people get into a state of health where they can get better and stay better with your recovery. And then why do you open this clinic?
Okay, awesome. So it really boils down to meeting people where they're at. So I understand what it's like to not have a plan, to not have a routine, to not understand what to do. And so my goal is to first just get an understanding of where you're at. Why are you where you're at, and how can we get you to move forward? What do we need to work on? So I kind of put out personal stories of my time learning different self-care routines and how to implement that in the daily life. So I don't have any kids. I just work right now,
So
but
jealous.
I imagine, people that have kids or they're working and they're trying to squeeze it in that 30 minutes at the end of the day. I know it's really hard, but just getting people to understand, it's a little bit of time in the beginning, and then it's just habits, daily habits, 10 minutes, 5 minutes. And then it's just changing your mindset and giving you the tools, to move forward.
I think a lot of people too, they've gone through a period of, I'm going to start now because I've had this injury, because I've gained this much weight and I can't fit in my pants anymore.
Right.
I feel depressed, I feel anxious, I feel like I used to do that, now I fall in the habit. They've almost had to go to a low point and find out. Myself, I tore my shoulder before. I never knew what stretching was until I tore my shoulder.
Right.
Now I stretch every day. Part of my routine, I approach my patients, but again, some people won't listen or start their habit until they have that low point in their life. How do you, and going back a step too, why did you open up this business instead of going to become a therapist somewhere else or a clinic, or why was this your thing?
Yeah, so it's very personal for me. I've had a ton of sports injuries and work injuries and sitting in the car injuries and reaching over and picking something off the floor. And so, I was always passionate about health and wellness. I've worked in a lot of different disciplines in the health and wellness field, hospital settings, athletic training, sports, chiropractic, physical therapy, and massage therapy, and kind of the combination of exercise and rehab kind of married all of those things. So for me, I've gone through different rehab stages and getting people to understand that it's really simple and that it can be done, and you can get your health back and get rid of the pain and get rid of the headaches and all of those things it's really important to me.
What I like is that you're not only are you opening up a business per se, but you're certified as a massage therapist here, as long as Texas, along certifications in personal training, ergonomics, and as an exercise specialist.
Right.
Why did you feel you needed to do that, or why is that important?
I think it just helps me as a practitioner really understand from different fields. We're one body, but the body is made up of so many different pathways and chemicals and reactions and the environment we're in. And so it's bringing all of those tools together so that I can say, hey, your knee hurts, but maybe it's not just that you're walking funny. Maybe it's something else. And maybe we dive deeper into that and help you understand kind of the root cause, and then give you all the tools, which is not always just one thing.
What I like too is that you have the experience and knowledge working in the field for a long time now to understand, okay, how do I now take that information and use, like you said, on people? And people are different. They have different lifestyles, different injuries. They're just physiologically different people, and even mindset too. So you understand exactly how to go through this to help them not only change their physical body, but also their mindset too. So let's go also to what are people usually struggle with when they come to you? What's their physical and mental struggles?
A lot of it's the usual, my neck hurts, my back hurts, I've got this crazy migraine that won't go away. And a lot of that just stems from all kinds of different things. And so, we try to pinpoint, okay, let's figure out why your back is not in the proper position. But it's really important to me in our initial evaluation to have them move, have them go through the different things that they do at home or in their workplace. Okay, let's see you bend over, pick up something off the floor. And so if it's just a small tweak that we could make, that's really simple and easy, and then we'll get you going, give you exercises to strengthen, and then you're good to go. But it's not always that simple. And so, it's
stayed at that point in your office for one too, your clinic.
Right.
Also, what's the mental struggle that people deal with initially when they see you?
I think a lot of it is just not believing that they could get out of pain, because it's been a lot of people have had, low back pain, especially for 10, 20, 30 years. From an injury way back when, and so that starts to take over, and we start to kind of lose that mental sense of what it feels to move good and to feel good and to not be in pain. And then on the flip side, there's a lot of emotional, physical stress on the body with all the changes in the world that we're constantly seeing, changes with our kids and with our families, personal things and coworkers. There's just so much going on, and so a lot of the physical things that I see kind of sometimes break down into the mental part. And so, in my office personally, I create this environment where it's really relaxing, and it gives you a space to just kind of unwind. And sometimes that's, very emotional for people, and sometimes that's just letting people talk and let people, get things off their chest that they're not usually able to.
What I like is that you're giving them a space to feel safe too. Okay, how do I get this emotion? How do I get back to that mindset, that motivated mindset, where sometimes it's going to hurt, sometimes it's going to be comfortable, but at that point I have to get there to get myself healthy.
Right.
When you walk through your treatments with your clients, how do you assess them what they're going to need? Because you offer a lot of different things at your clinic.
Yeah. So I have kind of a series of questions that I'll ask, related to lifestyle, related to work. What's your level of pain? How long have you been like this? What are you not able to do because of your pain or because of the emotional stress that you've had? And so it's assessing kind of all parts of the puzzle. And then before I start doing any kind of therapeutic work, massage, manual therapies, I'll have them get up and move. Let's do some muscle testing. Let's see how your shoulder is moving. Let's see, why is your back hurting only when you're sitting down? And then I have people stand up. I've had people do like a simple squat assessment, or like I said, reaching over and picking something up off the floor so that I can visualize. And then even further than that, I'll record sometimes. If people are not really sure what's going on, let's record, let's show you, and then I pull out my anatomy app and we'll walk through. These are the muscles that I think are causing your pain. This is where we're going to spend time, and then this is, I can easily send them the videos, send them the anatomy app pictures so that they have a better understanding going forward.
What I like is that you're helping them understand their problem, because it's not our problem to fix, it's your problem to fix. When you go through that process, you're going through, Marcella, with your clients, a lot of it is you're helping them understand through visual, through auditory, through videos you're showing them too, and sending it to them. At that point, they understand, I have to take care of my own health. I have to build habits based on my motion in my shoulder. What's going on? You're teaching them what is an improper motion and why it causes that pain, not just let's go fix it and you'll be done.
Right.
You're helping them when you leave your spa or your clinic. At that point, they actually understand how do I get this better so it stays better.
Right.
How have you, with that process being in a few months too, have you seen people get better and improve, or how does that process been working with you?
Yeah, I mean, I've had a woman, I met at a Village Venture in Claremont in October, and she was I could just see it just in that 10 minutes, but it's not always that simple, and so sometimes, it takes a couple of sessions to first understand, to get inflammation down, if there's something else going on, we got to get all those things under control until we can really get to that source of the physical pain.
And a lot of it is when you get through that process, you understand exactly what's going on. At that point, you understand the person in general. At that point, you get things better over time. We do one quick pause, okay? Give me 1 second. Be right back, guys. We are in part 2. We had a quick break, so we're back on it for 1, 2. Going through everything you're doing right now, this is not touchscreen, sorry. with your treatments overall, we talked about the mental state, the physical state too. Exactly what's your frequency of care? How do you usually dictate that as someone's improving? How do you, assess them and so they see it and you see it, and how do you get to the next level?
So between my client and I, we have a really open conversation.
Mm-hmm.
Okay, this is how you're improving, or this is how you're not improving. This is what I kind of expected to see, you know, at the 4, 5, 6 week mark. And so, you know, we'll have a really honest conversation. Are you not coming to regular appointments? Are the exercises not being done? Do you not like the exercise?
Mm-hmm.
Is it not working for you? And so we just kind of walk through what's going on. I'll probably do some more evaluations of movement and muscle testing just to get a better understanding of what's going on. And so people, you know, in a couple weeks will start to feel better, but that's assuming, you know, all things are going well at home, all things are going well in the office. And so it's just an honest conversation. Hey, where are you now? You know, just in the beginning, I asked you, where are you feeling? How are things going? And then it's the same question, you know, a couple weeks down the line after we've worked together, and then we come up with a new plan of action. Okay, this is how we're going to fix this, or you're doing really great. I don't think you need to come in once a week for the next couple weeks. Go on your own, try things, try new things, you know, get back to that baseball game that you've been trying to play with your friends.
Mm-hmm. Well, I like it. It's quality of life, right?
Yeah.
What do you like to do? And can you get back there? So because of that, in my sense, now you've done enough rehab, you know what to do. When things go backwards, give Marcella a call. Hey, I need a reset. What's going on? So she helps you get through that. But once you get your quality of life back, maintain that, people.
Right.
It's okay. Once I'm there, it's not like, okay, now I'm done. No. Now you have to maintain that, which is easier to do than starting over again. I don't like to stop working out because it hurts too much to go back. That's my thing. No. But overall, can we get there and stay there so your overall body can stay healthy? And when you need to reset, because once you're done, and again, as you know, once you're at a good standard and you've been there for, say, 2-3 months, your body has physiological change to that healthier state.
Right.
So you're going to know when your body's been dropped off. I'm having a little shoulder pain. You're going to know when to go talk to her. Hey, what's going on? If there's a bit going on, what else can I do?
Yeah.
At that point, it'll give you the reset again, too. Reassessment, boom, get you better. But once you do a reset like that, once you're at a better state of health, at that point, it's a faster process.
Yep.
You're in and out, boom, you're done. But having that quality of life is really up to you long term. Getting to recovery and getting to a better state of health is Marcella's job to help you get through that, to learn exactly how to help your body. Good.
Absolutely.
And with so far too, what do you want people to, as a takeaway, to help, I guess, connect with you to understand your process and your system and your treatments?
So in order to become a patient client with me, I do require a phone call just to kind of get a better understanding of where you're at. If I can't help you, I will let you know. You know, there are certain things way out of my scope of practice that I am more than happy to let you know. And I've created a network and will continue to create a network of people that I can refer you to that specialize in, you know, a very specific condition or something I've never seen before.
Like what?
So many things.
What I like to is that you have, okay, if I don't know this, you get my health team on it. So at that point you get healthy. If you're a medical problem, good.
Right.
Let's get you over there first, and then we'll get you back here once your body's ready to get to that state.
Right.
But again, a lot of people now, they take forever to see your doctor. I try to make an appointment just to follow up, a yearly follow up. I'm 2 months out. I could be dead in 2 months. You know, but a lot of it is we want to make sure we can get if you want to call consultation done first. At that point, you know exactly what you should be doing. Okay, let me go in and see Marcella, or maybe it's not. It's more a medical problem.
Right.
And if it's not, okay, let's figure out what's going on. A lot of people, I think, they have an anxiety of calling someone to exactly, okay, what am I do? But I'm glad you're accessible, Marcella, for people. So that consultation, that phone call helps, if you want to alleviate that stress.
Right.
Okay, I'm not doing the right things. Or now I know what I have to do for 1, 2.
Right.
You also have your website, SoCal Fitness and Massage, correct?
Yep.
.com. And do you want to give me their phone number?
Yeah, so my phone number is going to be 626-533-9459, and you can call or text anytime. If I don't answer, feel free to shoot me a text. Hey, you know, I'm interested in a massage. Here's my name, phone number, email. And if you know you have very limited time, just let me know a couple good times that work for you, and I'll reach out to you. Okay?
But I love that she's down the street from me. She's accessible to you. At that point, don't call her like at 10 o'clock at night. That'd be dumb. Or text her on a Sunday. She's fine. She has Sabbath off. But you can be respectful for 1, 2. Enjoy in the sense where you have someone to go to for either a recovery or a routine that you may have done before that you want to get back into. And it's going to take time, energy, yes, money. Sorry, things aren't free in this world. But at that point, give yourself that quality of health that you deserve starting now in December 2022 and 2023 for the whole year and years ahead. All right? So Thank you, Marcella. Appreciate
Thank you so
coming.
much.
Quick picture.
Yep.
1, 2, 3.